Assalamualaikum and hello. In this video, I and my team member will present about our segment with the title Unlocking the Benefit of Vitamin D, Important, Health Risks and Recommendation. For further information, I will pass this to my next member.
My name is Harila and I'll talk about the importance of vitamin D, which is a vital nutrient for maintaining good health. We'll cover its key functions, sources, types, deficiency risk, and strategies to improve vitamin D levels in individuals and communities. So, key functions. The first one is it helps the body absorb calcium and phosphorus, which is essential for healthy bones and teeth. The next one is it supports the immune system in fighting infections. So, the sources of vitamin D. The first one is sunlight, which is produced in the skin when exposed to UVB rays. The second one is foods, which is found in fatty fish, eggs, fortified milk, and supplements. Now we are going to know the types of vitamin D. The first one is vitamin D2, which is called ergocalciferol, which is found in plants and fungi. The next one is vitamin D3, which is called cholecalciferol, which comes from animal products and sunlight, which is more effective at increasing blood levels. So the role in the body, it activates the calciferol, which controls calcium use in the body. It also supports cell growth, immune responses, and bone health. And the last one is deficiency risk. Weak bones, fractures, rickets in children, and osteoporosis in adults.
Next is the importance of vitamin D for health. Vitamin D plays a crucial role in both bone health and immune function. It helps the body absorb and retain calcium and phosphorus, which are crucial for maintaining strong bones. Calcium is an essential mineral that's critical to healthy bone and teeth. This means it's really important for our bone health. Vitamin D helps calcium get into our bone, and enhance the efficiency of intestinal calcium absorption, with optimal levels increasing absorption 10 to 15%, which is low, to 30 to 40%, which is average. Insufficient level can lead to bone weakening, fracture, and myopathy. Vitamin D also maintains bone mineral density and prevents conditions like osteoporosis and rickets. Beyond its bone health benefits, vitamin D also plays a crucial role in immune health, uh, demonstrating various effects on inflammation, autoimmune disease, and infection rates. In healthy individuals taking vitamin D, which is 2000 IU per day, were less likely to develop autoimmune disease like rheumatoid arthritis and psoriasis. It also enhanced the production of antimicrobial peptides like cathelicidin, which directly combat pathogens and regulates the inflammatory response. That's all. Next, vitamin D also help in cancer prevention and our cardiovascular health. As previously mentioned, vitamin D has a vital roles in the immune system and our apoptosis, which is cell death. By maintaining adequate vitamin D levels, it may have a protective effect against some cancers, including breast cancer, prostate cancer, and colon cancer, due its influence on cell growth and differentiation. For our cardiovascular health, low vitamin D levels have been linked to increased risk of heart diseases such as hypertension, heart failure, and stroke by regulating our blood pressure and endothelial function. That's all.
Let's talk about why vitamin D is so important. Without enough of it, children can develop rickets, which is a condition that leads to soft and weak bones. Adults aren't spared either. They can suffer from osteomalacia, which causes bone pain and muscle weakness. And let's not forget osteoporosis, a condition that makes bones more fragile and prone to fractures. Clearly, vitamin D plays a big role in keeping our bones strong and healthy. But it's not just about bones. Vitamin D deficiency has been linked to a higher risk of chronic disease, like certain cancers autoimmune disease, high blood pressure, and even infection. This really highlights how essential it is to overall health, not for our skeletons. Why are so many people deficient in vitamin D? There are few reasons. First, limited sunlight exposure. People living in places with long winters, high pollution, or who spend a lot of time indoors don't get enough sun. Second, dietary insufficiency. Let's be honest. How many of us eat enough fatty fish, fortified dairy, or egg yolks regularly? And third, certain health condition and medication can make it harder for the body to process vitamin D. These factors combine and make it a widespread problem. Now, while deficiency is the bigger problem, we also need to mindful of vitamin D toxicity. This happens when people take too many supplements. It can lead to hypercalcemia, which causes nausea, vomiting, weakness, and even kidney issue. So, it's all about balance. Interestingly, even in sunny places like Kota Kinabalu, Malaysia, people can still have vitamin D deficiency. Why? Well, cultural clothing practices, staying indoors too much, and air pollution can limit sun exposure. It's a reminder that this issue isn't just about geography, it is also about lifestyle too.
Alright, my name is Nur Saiful Nizam bin Roslan and I will talk about recommendations for improving health outcome with increasing vitamin D level. The first step is increasing vitamin D intake through dietary intake. Fish liver oil and meat of fatty fish, trout, salmon, tuna and mackerel are one of the food that contain vitamin D. Vitamin D and calcium supplementation cause modest improvement in bone mineral density across the skeleton in postmenopause women and elderly men. Additionally, they lower the rate of fracture among elderly individuals confined to institutions. Vitamin D intake through supplementation. Dietary supply can contain vitamin D2 or D3. Additionally, vitamin D increases resistance to some illness, for example, reducing the risk of skin cancer, hypovitaminous D, and an inflammatory mediator. Vitamin D intake through fortification. Food are fortified or enriched by adding essential nutrient and mineral. Fortification with vitamin D has been shown to promote greater muscular mass and strength. Vitamin D fortification helps support the maintenance of a sustainable equilibrium in the serum level of steroid hormone such as testosterone. Which encourage safe sun exposure. When exposed to ultraviolet radiation, their skin can produce the hormone vitamin D. The main way to increase serum vitamin D level, which are responsible for several health advantages, is through UV exposure. Increased vitamin D level are linked to the protection against the development of cancer, particularly melanoma. Adequate amount of vitamin D can help prevent cancer and chronic disorder, while insufficient level can increase their incidency. The last step is community and policy effort. Since then, emphasis has been placed on the significance of raising public understanding of vitamin D. Consider using a variety of media platforms, such as enlisting well-known proponents of science to help spread the word. High-profile examples, such as death from a vitamin D deficiency, could also be used to draw attention to the issue and emphasize how important vitamin D is for good health. That's all from me. Thank you.
In summary, vitamin D is important to maintain strong bones and teeth, boost the immune system, and prevents diseases. So, the challenges with vitamin D is limited sunlight exposure, especially in certain regions or seasons. The next one is insufficient intake of vitamin D rich foods. Also, health conditions affecting vitamin D absorption or processing. So, health problems from deficiency is weak bones, fractures, osteoporosis, and rickets. Increased risk of chronic illnesses. So, the solution to improve vitamin D levels for individual is eat more food rich in vitamin D, such as fish and fortified products. Spend safe amounts of time in sunlight and also use vitamin D supplements when necessary. And for the community and policy efforts is to promote food fortification programs, raise awareness about the importance of vitamin D, develop guidelines and policies to address widespread deficiencies. So the overall goal is to improve health outcomes by addressing vitamin D challenges and ensuring people get enough of this essential nutrient. That's all from us. Thank you very much.